Welcome back to Insight in the Industry, Season 5, Episode 3. Thank you so much for watching our videos, subscribing, resharing our content. We really appreciate the support you guys have provided us these last couple of weeks. Make sure that you guys hit up our Insight Industry consulting business in regards to finding internships, fellowships, updating your resume, or CV. And if you're interested in joining our podcast, feel free to reach out to us. Email us at insightintheindustry03@gmail.com. We are interested in finding new stories and perspectives as we navigate the interesting landscape of the pharmaceutical industry. We really appreciate your guys' support again, and please hit that subscribe button and reshare our content.
Welcome back to Insight into Industry. My name is Talia Carlson, and I'm a second-year pharmacy student at the UNC Eshelman School of Pharmacy. Today, I'm joined by Matt Krall, a PharmD MBA candidate at UNC Eshelman College of Pharmacy in the graduating class of 2025. So thank you so much for being on today. Super excited to have our viewers listen to your story. And I guess just to go ahead and get started, could you start by describing your career journey so far and what that's been like for you?
Yeah, of course. Well, thank you so much for having me. I'm excited to be able to talk about this, and it's definitely something I'm very passionate about. So I've had the chance to complete 2 full years of pharmacy school, 1 full year of business school, and then now I'm in the blended year where I do pretty much pharmacy in the morning, kind of business in the afternoon. But going into pharmacy school, I knew I wanted to do something non-traditional. I come from a line of about 16 or so pharmacists, and they really gave me a great perspective of what the options and abilities were going to be with a PharmD degree. And I quickly realized that I love patient care. I like to be in the hospital and be able to see the impact I'm able to have on a patient's life day to day. But I was only impacting 1 to 2 to 3 patients a day. And while that's amazing, I realized I wanted to do more. And so that's kind of what pushed me to pursue the MBA, was to really gain the business acumen and the skills necessary to be successful kind of in the industry. And, further down the line, I haven't really figured out exactly what I want to do with my career. Right now, my interests are definitely in the commercialization process, more specifically marketing, kind of marketing strategy. But if you drill down into that, there's so many different roles. And so I haven't really figured out exactly which role I like. But so far, it's been a great experience. And I love being able to attend both schools because they really teach you obviously different things, but a much different way of thinking. And it kind of opens your mind to all the possibilities you're able to really achieve with an education and a skill set, kind of following that dual degree path.
Yeah, that's awesome. And yeah, definitely awesome that we even have the dual degree program to consider that bigger impact scope you're kind of talking about. I guess I saw that you did the commercial consulting internship at Exenda. So I guess could you talk more about that experience and why you decided, like more about what that experience looked like and what commercial consulting is?
Yeah, of course. So the summer after my PY2 year, before starting business school, I interned at AmerisourceBergen, but more specifically for their internal consulting firm called Exenda. And so I was hired on with no business experience, and my role was a medical communications commercial consulting position. So what that really entailed was a lot of the global scientific communications that big pharma companies need in order for assets to enter phase 3 or seek regulatory approval. Really anything that requires very complex scientific language and needs to be a document that is either sent for approval or sent for some sort of kind of regulatory body. And so going into this, I really had no idea what to expect. I had never worked at a large company. I had never been a medical communications intern. But a lot of it was mostly being able to create AMCP dossiers and kind of the documents necessary to get drugs on formularies for insurance companies. So a lot of our clients were big pharma companies who had molecules that were getting close to phase 3 or kind of maybe leaving phase 3, and they were seeking approval. And so over the summer, I was able to work a lot on the documents that showed the value of the medication and what it was able to provide to patients, but kind of in a twist to show more of the payer lens of it and some of the cost offsets and maybe some of the top line statistics that really showed what the medication was able to do versus competitors or what was already in the market. Now, I think most interestingly too, that internship was completely remote, which my first year of pharmacy school was right in the middle of the pandemic. So I was used to the remote environment. But, like one thing about an internship is you're starting at a new company and you really want to meet a ton of people. You want to see what the company's about, what the culture's about. And so while I loved my internship there, the virtual aspect of it, which it was nobody's fault, it was just the environment. The virtual aspect of it was a challenge for me. I love to talk to people. I love to meet new people. Before starting pharmacy school, I was actually a bartender, which is kind of funny that it's gone full circle from that. But I love to hear how different people think and how they approach different problems. And so that remote experience is a little difficult to adjust to. But I think my main takeaway from that entire experience was how to work in the business environment, how to talk to clients, how to listen to clients, how to understand their needs, what their budgets are, how to build a team that could meet their needs, but stay within budget. What happens if you went over budget, which, beforehand I'd be like, oh man, that's such a big deal. But in reality, there is a way to approach those types of situations. So I think the experience I learned, mostly for how to manage the business environment and the environment of having clients, was extremely valuable. And in that internship, I leveraged a lot more of the PharmD than any business experience I had prior to that. But it was a great opportunity, and I really enjoyed everyone that I was able to meet, and kind of the internship in general. It was a great experience, and it showed a different lens of the pharma industry because I wasn't working for a specific drug manufacturer per se. It was mostly just a giant distributor of kind of all of the medications.
Yeah, that's awesome. And that's a pretty cool experience, especially right before starting the business program, just to kind of, get you immersed. And I guess that kind of brings me to my next question. How did you decide which concentration to do in the MBA? I mean, especially coming in as a PharmD student.
Yeah, that's a great question. So it's actually something I went back and forth with so many times. So interestingly, with UNC, you don't actually have to graduate with a concentration. So you're not locked into one over the other, and you can switch them as many times as you want. The concentrations are mostly like guides that show which classes kind of tie into certain subjects. So obviously I went in, there are many kind of concentrations that span real estate, energy, sustainability, a lot of things that were interesting, but didn't really tie back to my PharmD experience and my real passion for kind of healthcare in general. So I went in knowing that one of my concentrations was definitely going to be healthcare. Pretty self-explanatory. I had the most experience there, and it's where I could see my career going. Now, the second concentration, I tossed around with three big ones. The first one being consulting, because of my experience at Exenda, and the allure of consulting was really cool going into my first year MBA. There was a lot of excitement around it. A lot of people were pursuing that avenue. The second one was marketing, which is actually what I ended up with. And then the third concentration was data analytics, just because I do like numbers, and kind of having that science background, you work with a lot of numbers and calculations and formulas and all that. But quickly within my first year of MBA, I realized that as alluring as consulting was, it wasn't right for me, just because one of the things I really try to focus on, both in school and I hope to find in a career, is a very stable work-life balance. I loved all my past experiences. I love school, but I'm also the type of person that when I'm done for the day, I want to be done for the day. I want to enjoy my time at home with my friends, with my family, with my dog, that type of situation. And so consulting kind of was a little difficult to find that perfect balance of work life. And I also realized that it was extremely competitive. Now, being a first year MBA, I didn't have any work experience. My work experience was my PharmD education. So while that is a differentiator, I didn't have any real world out in the kind of field work experience. So I saw that as maybe a disadvantage in my eyes, and something that if I wanted to, maybe my second year of MBA, I could focus more on the consulting path once I've had more experience and I understand more about the business world. But a lot of the prep for consulting interviews was very intense and required a lot of cases and a lot of prep that I just didn't really feel comfortable with, and I wasn't super confident in my ability to kind of approach those situations. But like on the opposite side, while I was struggling with that, I quickly fell in love with marketing. After the marketing core class that you take and a few of the other marketing courses at Keenan Flagler, I realized that it was amazing. It was really fun too, because it was getting inside of the mind of the consumer. And, you know, it's funny because you learn about these tactics that I've fallen victim to 100 times. Like you see these things on TV, you see these things on your phone, on your computer, and you're like, wow, this is really cool. I want to go check out that product. When in reality, it's a marketing tactic. And so like developing those and getting inside of the consumer's mind and really understanding how they think was an amazing experience. And it's why I really fell in love with marketing. And I think it all ties back to like marketing and healthcare, how they really work together, is that within the pharma industry, your products are medications. And the most interesting thing is like nobody necessarily wants a medication. They need the medication, which is a lot different than if you're a CPG firm or you're selling like paper towels or something along those lines. Like consumers want paper towels because they need them for their home, that type of situation. But nobody actively, well, I shouldn't say nobody, but in general, consumers in the pharma industry, patients, they don't actively seek out medications. They tend to listen to their doctor and do some research on their own, but it's a much different landscape. And so kind of tying in the science with the patients who could really benefit from this medication, in the middle ground of those two kind of pillars is really marketing, and more specifically marketing in healthcare. And so that's what I pursued going into the MBA. And I'm very fortunate. I really enjoyed it. I was able to take some amazing marketing courses and really think about how this would tie into a career and also how it would tie into the pharma industry in general.
Yeah, that's awesome. And it's such a it's an area I never even considered in pharmacy until having a conversation with you previously. And could you actually explain more? Because I think there's a lot of people have a lot of like I kind of came into marketing assuming it would look way different than I expected. Yep. So I guess could you talk a little bit more about your recent role that you just wrapped up at Eli Lilly and the MBA Marketing Intern at Cardiovascular New Product Planning? If you talk a little more about that experience and what that actually looks like in practice.
Yeah, of course. So to start off, like I was the same way. I never realized that marketing was as broad and had so many different opportunities within the field until I went to MBA and until I had these conversations. And so the main thing is like, if you don't have any business experience prior to this, you think of marketing as the graphics or the products that are displayed. And I'm thinking about like Taco Bell will throw a burrito down and the flames in the background. Like, yes, that's marketing. And that's what I always thought it was, you know, with the Diablo sauce and all this stuff going on in the background. But in reality, marketing in pharma is more strategy. It's more of planning what to do with the asset through all stages of the product's life cycle, so that when it comes time that the medication launches, you're able to have the documents and the kind of resources necessary to provide your sales team with effective sales tactics and kind of strategies, but also you are able to match what the market is doing at the time of launch. And so that was something I really learned over the summer. So as you mentioned, I spent the last 10 weeks up in Indianapolis at Eli Lilly and Company as a MBA marketing intern. And more specifically, I was in cardiovascular new product planning. So my experience is on one far end of the spectrum. New product planning is very upstream in the marketing cycle. It's kind of the first time that marketers really learn about the asset and start to work with the asset and develop strategies and kind of implementation phases. Whereas on the other end is like the launch team or the global brand team. And that's right before the product launches. You have an entire team that's working on the brand name and the brand images and the target providers, patients, payers, all that kind of stuff. It's two opposite spectrums. So this summer, my experience was much more strategic because the asset that I was working on wasn't expected to launch for many, many years in the future. And so this was a huge challenge to me because I've always been a very data-driven person, somebody that really likes to know all the information before I make a recommendation that my name is tied to. It's just, I think that ties back to the scientific background. And like, I remember presenting posters in undergrad, and it's like, you don't want to put something on a poster at a conference that you're not confident in your ability to explain, or that it's correct, or it's able to show something. And so the biggest adjustment I had to make was realizing that, the market today is all great and has a lot of different complexities to it, but in the next 10 years, it could be completely different. And so many things could change that could really impact this medication. And so, over the summer, I was in charge of making a strategic recommendation on how the molecule should be administered. And so it really tied into so many different factors, and it was very complex to understand, to get inside the mind of the patient, but also the payer and the provider, because those are the three main stakeholders that will interact with a medication like this. And so understanding what the patient's preferences are, the payer's preferences, the provider preferences, and how do you match those today, but then how do you also provide the flexibility and the agility to change and to be fluid with how the future is always constantly changing. So being able to project that out and see the future and imagine, like, okay, this is what it would be today, but how does it look in 2030 and 2035? And making decisions now that will allow your company and the asset to be the best suited and situated for the future. So that's really, like, I really enjoyed it. I kind of fell in love with it because it was much more strategic than I ever thought marketing could be. And granted, that is new product planning, so it's way upstream on that marketing cycle, and there's a ton of different roles in between new product planning and like a brand team. But throughout those different roles, you kind of move from strategy to more of execution. And then in the middle is a little bit of implementation and kind of testing certain theories and certain strategies out and adjusting them. So, for somebody like us who will have both degrees, knowing the science, knowing your patients, knowing the disease state and everything is amazing, because you're able to come up to speed a lot quicker. You're able to tie back to experiences you've had on your IPPs and your APPs. But then having the MBA allows you to think in that strategic mindset. It allows you to project out the financial forecast, project out the market CAGRs and how everything will change. And if you kind of mix those together, you really get like the perfect type of position where you're strategically making decisions that ultimately will affect patients. And so you have that business knowledge, but then it also ties back to why you went into pharmacy school and why you, at least for me, why I wanted to pursue a career like this situation.
Yeah, and that sounds super exciting to me, because you're right, like that's a really nice blend, and has that balanced lifestyle like you've kind of mentioned before. I guess, do you know what the long-term kind of job trajectories are after that more upstream marketing strategy role?
Yeah, of course. So at least every company does it differently, but from my understanding within the pharmaceutical industry is you would come in at a level where you would be leading people, but you'd also be a contributor, meaning you would have projects that you would own, your name would be on them, and you would be working with your team to make strategic recommendations. And that's true across any position that you have within marketing at a pharma company. Now the projects may be a little different, and it may be much more execution versus much more strategy. But when you come in with a dual degree at most companies, you will maybe not right away, but within a year or two, you will be leading a team and having projects that tie your name to it. And then as you gain more experience, and if you stay at the same company, as you move up, your roles tend to be much more leading and managing people rather than individual contributor work. Now you still have projects that have your name on them, but instead of working on one asset in one portfolio, you're working on 10 assets for one portfolio. And then from there, you would move into managing teams that's working on an entire business unit that has 3 portfolios with 10 assets each. And so it kind of moves in that function. And the one thing that I really loved about working at Eli Lilly is the flexibility and the agility that I saw over my 10 weeks and, through many conversations with people that work there. They provide the opportunity to move around and to find what you're truly passionate about and to find where you are able to provide the most, where you're able to really provide the most success for the company, but also you feel the most success personally. So it's a two-way street, and they realize that. And so, those first 5 years that you come out of school, you're fresh, you have a lot of ideas, you really want to get started. And I always like to think of that as the idea of like the breadth versus the depth in a career. And so those first few years after graduation, that's the breadth time. Find what you like, find what you enjoy, try different things, work for different people, find which subsection and subfunction you really enjoy. And then from there, build your depth and really hone in on whether it's a disease state or whether it's an entire function like oncology or something. Or, if you want to travel abroad, focus on international business units and how do you approach these same strategy and execution phases in the countries all over the world that are outside the US. So there is a ton of possibilities. And I think the main thing it ties down to is finding somebody that's at that company, a mentor that can help you work through all those things. And I was fortunate enough to have an amazing supervisor who showed me all the possibilities and really gave me the ability to see what was out there and to think, oh, this is something I could see myself doing when I graduate, type of situation.
That's awesome. I love hearing love hearing when people enjoy the culture they're working for, because that's I think people have become increasingly interested in the company's
Yes.
culture. So and so would you say, I guess, in terms of Eli Lilly's culture, like I guess could you speak a
Yeah.
little bit more to that? And then also what the extended culture was like, just
Yeah.
or like something unique aspects of each company that maybe people don't know before working.
Yeah. Of course. So I'll start off with Eli Lilly because that's the freshest on my mind. And one thing that I think makes Lilly very unique is their culture. It's something that they really focus on and really strive to be the best at. And in my mind, these past 10 weeks, I got to see that firsthand, and it was amazing. I think what it boils down to is there's this saying at Lilly, which is Team Lilly. And that essentially is every employee at Lilly, they're part of Team Lilly. And what that means is that everybody's there to help you. Everybody there wants you to succeed. They want your team to succeed. They want your project to succeed because they want the company to succeed. There's very little competition within employees and within teams. And there's very little kind of like bickering and competitiveness. And it's more of everybody, let's all work together to solve this problem. So the teamwork and really the mentorship that I received over just short 10 weeks was amazing. People were more than willing to meet with me. I was actually able to meet with over 90 people in my short 10 weeks for 30-minute one-on-ones. And that sounds like a lot, but it wasn't because I was like trying to hit a certain number. It was just, I would talk to somebody and we'd have such an amazing conversation. They would say, oh, you need to meet with these 4 people. And then I'd reach out to them and have a meeting on the books the next week. So people are just more than willing to help you. They want to talk about your project. They want to talk about your career. They want to talk about Indianapolis and all these different things. And so that was an amazing experience. I never once like went into work and was dreading it or dreading a meeting or was like, why do I have to do this? I was excited. I was like, oh, I get to talk to this person today. I can't wait to ask them this question about my project or this question about their role or something along those lines. So I think it was a very unique experience. It was very humbling too, because there are some extremely intelligent people that work at Lilly and extremely intelligent people that work in all of pharma. I mean, every company has them, but the ability for those extremely busy, extremely intelligent people to have 30 minutes and sit down with an intern is amazing. And they would get excited about the same things I would get excited about. And so it was really cool to kind of bounce ideas off them and be able to chat with them. And the same is true for Exenda, just a little less to the extent because I wasn't able to be there in person. So I wasn't able to have those hallway conversations and as many one-on-ones, but I still met with a lot of people who were very helpful and who really helped to guide my understanding of what commercial consulting, medical communications was. And my manager at Extenda was extremely helpful. And we actually, we set up a cadence of meetings, and the same is true for Lily. But the first week we met every other day while I was getting on board and figure everything out. And then it slowly went to, once a week, and then once every 2 weeks, and kind of stuff like that. So I think, again, having a supervisor that is very helpful really does make any internship better. But also realizing that in my 10-week internship, I was truly working on my project for probably about 7 weeks, because the first week you're getting onboarded, the last week you're presenting, and then July 4th was in there as well, which we were shut down for July 4th. So I really only had 7 weeks to figure out my project. And I wanted to meet with as many people as possible to get as many ideas and as many routes that I could explore and go down. And I think Lily made that extremely easy to kind of accomplish.
Yeah, that's awesome. And that's great to hear, because it's just, there's so many things I feel like people don't know about a culture, like Eli Lilly, a lot of the jobs being in Indiana, or just like even locationally, etc. So that's great to hear a firsthand experience. And I guess what just I guess I was kind of curious, because how medical science liaison, I feel like there's more of an emphasis on having a specific therapeutic area. Do you find that that's the case in marketing strategy as well? Oh, okay.
Not necessarily. Yeah. So again, you could, if you have like a passion for oncology, then you could be an oncology marketer for your entire career. And there's a ton of movement, flexibility. You could move to different assets, different fields, international, all of those situations. And so there is a ton of capabilities to kind of hone in on one disease state. And I know a lot of people are very passionate about oncology, or very passionate about neurology and Alzheimer's drugs and that type of situation. And so there are career marketers in neurology, career marketers in all the business functions. But on the opposite side, you don't necessarily have to have like that complete understanding of every disease state in order to find a role. So the perfect example is my supervisor, who worked in, I believe she started in neurology, and then she went to immunology, and then now she was in the cardiovascular unit. And so for her, it was more about the role. It was more about new product planning and more about being able to experience all the different disease states. Because yes, in essence, you are walking a drug from phase 1, from molecule discovery all the way to commercial launch. But there are so many different things that each disease state comes with that kind of change how you strategically plan them out. So the perfect example I like to use is with cardiovascular medications. The phase 3 trials are called CVOT trials, cardiovascular outcomes trials. Those are around between 15,000 to 20,000 patients, and probably around 4 years. Massive phase 3 trials. But for something like oncology or rare diseases, the trials are much smaller, maybe 4,000 patients over 2 years, or something where it's much smaller. So how do you understand that timeline and understand the costs associated with each of those phase 3s, and then strategically plan what you need to do with the molecule now, so that you make the most of the phase 3 trial and you're able to get the data necessary and achieve the goals that you want, so that by the time that it launches, you have everything necessary for the FDA approval. And so I always tell people, like, I love all disease states. I'm a little biased towards neurology just because I suffer from migraines, and that's part of my reason why I want to get into the industry. But I worked in cardiovascular and I absolutely loved it. And now with Lilly, at least, their bread and butter is diabetes and obesity. And there's so much excitement, so much hype around all the molecules they're coming up with, and the data they're releasing. And so I think that would be an extremely valuable opportunity to get experience in that portfolio now, while there's all this excitement, all this momentum, and a lot of constantly changing things, and then maybe transitioning to something else and working earlier stage type of situation. But it changes person to person. And so you don't need that strict disease state knowledge like you do with an MSL. So the reason MSLs need them is because mostly for an MSL, you will be targeting just oncologists, just oncology. And you have to be an expert in that, because you are going and talking to all of these oncologists who are experts in their field. So you want to be able to have that communication, have that level of trust, and and kind of a conversation with them. So for MSLs, it's much more important to be able to hone in on one disease state and one functional area, as opposed to a marketer per se.
Okay, yeah, that makes sense because yeah, they are just so different. But that's good to know. They don't have to necessarily specialize. I guess also I've noticed a lot of the marketing strategy roles, you can either choose a global or US focus. Could you
Yep.
talk about like the benefits or
Yeah.
what should kind of determine how you decide which one to start off on?
Of course, yeah. So my role this summer was actually a global role. And the funny thing is that whenever you hear global role, you think of everywhere outside the US. But actually a global role includes the US. So it's US plus outside US. And
Wow.
then you have the affiliate roles, which are the US itself is considered an affiliate, but then so is Europe or Germany per se, Japan, China. Those are all affiliates, and we have offices in all those countries, and those are the affiliate offices. So for the global role, at least, the global role is focused much more on broad strategy and broad brand development and brand planning. Like what is going to be our message across all countries? What is going to be our target sort of like patients across all countries? What is going to be our target providers across all countries? Now that kind of changes depending on which country you're in, but it's mostly focused on implementing and developing strategies that can apply to any market across the US. And then so that's much earlier on in the cycle. I shouldn't say much. It's about probably 2 to 3 years before launch. And then from there, as you get closer to launch and even post-launch, the affiliate marketers will take that global brand, I'm just going to call it a brand plan, but they'll take that global brand plan and distill it down and change minor things and adjust certain things to target their specific affiliate. And you know, if I go back to how confusing it is with the global and the US affiliate, a perfect example is with Lilly's release of Mounjaro, tirzepatide. The global brand team was able to develop a strategy that applied everywhere to all sort of countries and no matter where that we were hoping to kind of launch the product. But when you look specifically at the US is the most complex, which go us, I guess, but we are the most complex for launches. And what I like to kind of put that into perspective is with Medicare, there's a ton of issues with, or not a ton of issues, but Medicare is reluctant to approve or cover obesity drugs. And that's something that we are facing with Mounjaro. It's something that Novo is facing with Wegovy, and it's but that's a US specific problem. So the US affiliate, their payer marketing team would be responsible for, okay, how do we get Medicare to cover this? What strategies do we need to develop? How do we need to implement this? How can we execute our strategies to allow Medicare to cover this? Whereas, you know, the global brand team was more like, okay, we have this many Medicare patients. How should we change our messaging to approach that older population, or how should we look at different lenses and different opportunities to approach certain other populations on a global scale? So that's kind of an example that really puts it into perspective. And you know, one piece of tidbit I learned over the summer was that within China, like each province within China negotiates the price of the medication. So it's not like one central government. Well, the government will negotiate it, but then each province will negotiate it more. So understanding that there's a potential to take 2 price cuts versus just one in other countries, and like how do you plan for that? How do you strategically market for that so that by the time you launch in China, you have all your ducks in a row and you know, like, okay, we're going to have one negotiation here, one negotiation here. How do we need to market it? What value propositions do we need to have? What evidence is most important to Chinese regulators versus German regulators or something like that?
So I guess, wow, that's a lot of factors you have to consider. I guess which teams are you working with because I've heard a little bit more about market access and it sounds
Yep.
like they do some of that payer negotiation.
Yep.
What are the main parties that you guys are interacting with to achieve the marketing strategy team, like on the day-to-day, and what are your main priorities? You've touched on them a bit, but just
Yeah. Of course. So, whenever you're working on a molecule, you're right. There's a ton. It's a ton of cross-functional teams. So the first one is for instance, like the PRA team, the pricing, reimbursement, and market access team. They will negotiate a lot of the prices. They will actually do a ton of pricing information and come up with the price. They'll come up with reimbursement schemes and how everything like that works. But then you also have at Lilly, it was called the Lilly or the LVO, the LVA, I'm sorry, Lilly Value and Access. And that's like what is each customer, what do they care about? How can we show them value? And so the example there is certain payers, commercial payers will care more about top line ARR, absolute risk reduction, whereas like HCOs and healthcare organizations, large hospital systems, they care a lot more about the health economics data, the cost offset of one medication versus one stroke or one MI. They care a lot more about that than they do about the ARR versus like, the commercial payers. And everybody's different. I'm sure that that's not the same across all the US, but that's just to kind of put it into perspective. And so that's considered like payer marketing, at least those two functions are. And then you have provider marketers, HCP marketers, who will be targeting, either cardiologists or oncologists or whatever the drug is indicated for. They will be changing their messaging and kind of adjusting the brand to target certain providers. And then the last thing is like essentially how do they all work together? Well, there's one person from each of those teams on every stage of the marketing cycle, and they represent or they are kind of their point person for that asset for their team across multiple different stages. And what can they bring from their experience with other molecules or their experience with negotiating with Medicare? How can they bring that in to plan the strategy early enough so that by the time that it launches, you know what needs to be done in order to allow for Medicare or for a commercial payer to see the value, to know those ARRs and to understand or why to put a certain medication in front of another one on a formulary, or to avoid step throughs, or to avoid PAs or anything like that. And so that's kind of like the payer lens. And it changes depending on which disease state you're in and which molecule you're working on. But I think that like one of the most important things, at least that I learned over the summer and that I saw, was how valuable everybody is. Like there's not one person on the team whose role is replaceable. You need everybody. You need all their experience, every understanding, because the strategy you're developing has huge implications 10 years from now. And so you need to be able to understand like how things are going to change so that you can adjust for them in the present day.
Yeah, wow, that's so many factors. And does it look the same at most companies, or does that kind of dynamic change company?
It probably works the same. Now, the only pharma company I've worked for has been Lilly, so that's mostly what I'm tying my responses to. But from my conversations with other dual degrees, it seems the same for most companies. And they might call them different things, and they might have different team structures, but overall, each brand team, each asset team is going to have a representative, going to have somebody with that experience that will be doing the market research and will be attending the meetings and talking about the strategy and helping the team develop the overarching kind of strategy that's presented to senior leadership. So I'm pretty sure that's true at most other organizations and most large pharma companies. And each one's probably a little different. But the most part is like it's staying kind of top level is knowing if you want to be in like payer marketing, or if you want to be in provider marketing or brand planning, or global brand team or something like that. Those are pretty much probably the same throughout multiple companies.
Yeah, that makes sense. Like, yeah, those are a little bit more stuck. And I guess what do you think is the best kind of experiences students should be seeking out to maybe prepare them for roles such as marketing strategy?
Yeah, of course. So first off, like I'm a huge proponent of the dual degree program. If you're listening and you're from a other school besides UNC, and your school offers it, definitely look into it. Obviously, if you can afford it, and if it works out with your timeline and personal needs, and kind of all those factors. I'm a huge proponent of doing the dual degree because, at least for me, I've been a student my entire life. I wanted to get the MBA done with because I know I wanted to do it, but I didn't want to do it 5 years from now and give up 2 years of lost wages and have to come back to school after I just spent, probably, I don't even know how many grades I've been in, but let's say 20 years in school. No, I'm only, okay, whatever the math, the math works out to. I didn't want to come back after spending so long in school. So that's kind of why I wanted to do it at the same time. So definitely, if your school or anybody listening has the opportunity to look into that, I would. The second thing is, a lot of companies will also sponsor MBAs. So if you come out of pharmacy school as just a PharmD and you want to go into sales or into MSL or into any of the more scientific roles, look for opportunities within your own company. A lot of companies will pay for their employees to go back to business school, and you could take your pick. You could go to the local one wherever your company is, or you could go live somewhere else for 2 years, or kind of whatever you'd like to do. And then the third one is that other companies will have development programs. So I know Bristol Myers Squibb, BMS, their internship program is called the CLDP, Commercial Leadership Development Program. And so that they actually, after you graduate, you have 3 years where you do 3 different rotations in different marketing fields. And then you get to kind of pick which one you want to do after that. And so then you could start your career in whichever one you pick. Lilly has something called the LMA, which is the Lilly Marketing Academy. And that is something that, as just a PharmD student, you could come in, work at Lilly for 6 months, a year, and apply to that academy. And in there, they give you the experience that you go through rotations on these cross-functional teams to gain that marketing experience, to kind of pivot your career from an MSL or from a scientific writer to a more marketing role. So that's mostly focusing on like post-grad or kind of gaining the skills necessary. More in school, I would really start to focus on understanding like what it means to be a marketer, and also what if it is something that you're interested in, because it's not for everybody. Some people really enjoy the hard data stuff. Some people really like to write. Some people are more focused on the finance stuff. It's really dependent on the person. But if you are interested in marketing, look more into how each company does it and what it means to be a marketer in the pharma industry. Because like I mentioned, it's a lot different than every other marketing field out there. It's not like you're trying to sell a car, or you work for Tesla and you want to sell solar panels. You're selling a potentially life-saving medication to a patient that needs it. But a lot of the times they can't afford the cash price of it. So you're having to market it to their insurance company and discuss negotiations with them. And so really understanding how a marketer works within each field. And a lot of the things you can tie back to is reading like Procter and Gamble. They're the gold standard for marketers. They have created and developed amazing marketers for the last, 30 or so years. And so looking at what they do and their tactics and understanding like their consumer behavior and like information and how they go about launching extremely successful products, and then think, okay, how can I do this for a medication? How can I do this for a drug? Like, what's different about this consumer good versus this medication? So starting to experience those things. And Google is your best friend. And I know that's not a perfect answer, but maybe just understanding like how certain companies look at different stages of the marketing cycle and how they plan differently. Now that data may be harder to find, but it'll hopefully still give you the same sense of what's going on in the environment.
That's awesome. Yeah, no, that's super helpful resources to kind of get your mind like in case someone is interested in this field. So that's super helpful. And then so actually we're at the last question. So
Okay.
Just generally we like to ask very broadly, what is one piece of advice or insight that you would like to give to a pharmacy student interested in just generally the industry?
Yeah, of course. And so There's a lot.
Yeah.
I'm a huge quote person. I love quotes and I love to gain advice and kind of really consider it. But at its core, I think the biggest advice I have is don't be afraid to try, and know that whatever you try yourself or whatever you try to do, you might be good, you might be bad, but you tried. And that's the biggest thing is search for opportunities and search for experiences that'll allow you to be yourself, that'll allow you to gain education and gain skills, but it'll also allow you to reach personal goals. Don't devote yourself just to work, because people get burned out. We saw it with COVID. We see it with every day, where people focus on one thing and one thing only, and they forget that they're a human and they have a life. Experience life. You're only this age once. You're only in pharmacy school once. You're only in business school once. Know that there are things outside of grades, and there are things outside of applications and GPAs and everything. So really take the time to know what you think would be cool, try it out. And if you don't like it, it's okay, because you're going to be a pharmacist one day, and that sets you up to do so many things. And then if you want to go into the industry, you're going to have so many opportunities. When one door closes, 10 more open. And so don't be discouraged if something doesn't go your way. And not to discourage anybody, but after PY2 year, I applied to like 144 internships, and I got maybe 3 emails back. And not saying that people need to do that, because I went a little psycho on that, I'm not gonna lie, but it's okay to realize, like, it didn't work out with all those other ones, but I loved my internship at Exenda, and I love that experience. And so I wouldn't trade it for anything else in the world. And I would have never known that if I didn't try it out, if I kind of just stuck to my little cubicle and didn't move out of that. So definitely just try, and don't be discouraged if it doesn't work out.
That's super awesome, and definitely agree with that. Well, thank you so much for taking the time to talk to our listeners today. I know I've learned a lot from it, so I'm sure our listeners will really benefit from hearing your perspectives and everything. So
yeah, of course. And if anybody listening wants to reach out to me on LinkedIn or anything else, please let me know. I'm more than happy to talk with anyone and kind of experience it. I just real tidbit. I am an only child, and so I come from a small family, and I didn't know any of these things.
yeah.
So I had to learn on the fly and talk to people. And I think this podcast and the people that produce it are really help students kind of see what's out there and see what you can do with a PharmD, because there are so many things that I didn't even know were possible. And now I'm like, wow, that sounds amazing. I want to do it. So definitely keep on looking for opportunities and keep on kind of doing these things.
Yeah. Thank you so much.
Thank you so much for watching our videos, hitting that subscribe button, and resharing our content. However, 80% of you guys are not subscribed to our content. So please, 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 we would really appreciate it if you guys would hit that subscribe button, reshare our content to other students, and turn on post notifications so you guys can keep up with our day-to-day content, our once a week podcast, or our day in the life videos. And again, if you're interested in landing an internship, strengthening your resume or CV, please feel free to hit up Mayor and Alex for their new consulting business that is associated here with Insight to Industry. And thank you again for watching our videos, and have a fantastic day.